This is a very significant day for people who care about primary care in BC. It's a transformational announcement we're making today.
A raise for family doctors in BC, one of several changes the province has unveiled in a new compensation model to try to ease pressure on the healthcare system.
It is by far the best agreement negotiated for physicians in Canada this year, and I believe it is one of the best that has ever been negotiated here in BC.
Co-developed with doctors of BC and BC family doctors, the plan will see a full-time family doctor paid on average $385,000 a year, up from the current $250,000. The new fee schedule will also add pay for hours worked, the number and complexity of patients, and for administrative costs.
This improves and incentivizes family practice and improves things for patients as well by building out team-based care for them. And so I expect this will lead to more people and more doctors practicing for longer.
We're reviewing labs, we're reviewing x-rays, we're writing up reports to refer patients to specialists. All of that takes time. We haven't been paid for that in the past.
Dr. Baldiv Sangera, a family physician in Burnaby, says the plan gives him hope. While he's waiting to see full details, he believes it could attract new doctors, persuade existing doctors to stay, and see doctors take on more patients.
If I know that I'm being compensated for all of the work that I'm going to do, I will do it. What it also does, though, is it also makes me then go talk to other colleagues and say, hey, I'm getting paid for everything that I'm doing. I feel happier about that. I don't feel burnt out by that. I will now also attract other physicians to come and join our practices.
But some aren't sure this will solve problems in the healthcare system.
It might be an attractive package for new grads who are finishing their training. It might attract some people who've been doing other work in the system to come back to longitudinal primary care, but there's a lot of mites in there.
McCracken says while the plan is a step in the right direction and will help doctors who are currently practicing, she isn't sure it will help the estimated 1 million British Columbians who don't have a doctor.
If we had 1 million kids who didn't have access to public schools, we wouldn't just be paying teachers more, we'd also be building more schools and investing in that infrastructure to ensure that the kids get the access they need, and the same thing needs to happen for patients.
She believes more investments need to be made in clinics, and Dix says there's more work to do.
This is a key element, but one element of our overall Health Human Resources plan.
The 3-year agreement, which still needs to be ratified, would take effect February 1st. In Burnaby, Monika Gul, City News.